Alright, here's my complaint against Dr. Ara Deukmedjian with the State of Florida Department of Health. And if you want to know all the details about what happened to me, I've done several hours of video on my exchange with Dr. Deukmedjian. You can see those videos, recorded telephone calls, uploaded medical records, images, doctor's reports. They're all up there on my YouTube channel, My Medical Nightmare. Dr. Deukmedjian of the Duke Spine Institute, 7955 Spyglass Hill, Melbourne, Florida. He offers a free MRI review, and this was a scam. I sent my images to this doctor. As you can hear in the recorded telephone call at the end of this video, injuries appeared in those MRI images that I sent him. And in my consultation, you will hear him flip-flop. And this tells me that this doctor knew something that he was not willing to share with me. At first, he told me that he did not believe that I had broken a bone on the underside of my skull. A few minutes later, he then began to repeat that he was not going to address that area with me. In the injury in question, this is the only reason I'm going to these doctors in the first place. Alright? He asked me about pain, point to where the pain was in my neck area, but he was not willing to address injuries that visibly showed up in the MRI pictures of the inside of my neck and the lower portion of my skull. And this is a big problem. Deukmedjian tried to say that he was not skilled in this area, and I call BS. According to his own website, this doctor is a fellow of the American Association of Neurological Surgeons and a member of the Congress of Neurological Surgeons. He was awarded a neurological surgery residency by the University of Florida, 1997 through 2004. At first he told me that he did not believe that I had broken my skull. Then he said that he was not going to address that area with me. The only reason I sent the pictures to him. And then finally he asked me, well, what did the other doctors that originally read those MRIs say my injury was? And those original radiologists and doctors who looked at that MRI, they misdiagnosed me, and I told them this. And this Dr. Deukmedjian, he will be held accountable for his actions, as will the other doctors who misdiagnosed me to begin with. This doctor never properly finished our consultation. What happened was I had printed out the pictures of the broken piece of bone and infection that appeared below my skull, and I started to hold them up to the camera. You'll hear him repeat again and again, neurologist, neurologist, and then he abruptly terminated our Zoom meeting. Alright, he started getting real nervous, and he all of a sudden wanted to end our consultation. So that should tell you a lot about this doctor. Again, a good doctor who does an MRI review, is he looking at the MRIs, the actual images, or is he looking at what the doctor wrote out? Because doctors who are just repeating the words of other doctors, that's not what practicing medicine is about. Alright? Real doctors out there, they apply their skill that they went to college for all these years to obtain these degrees, to present to the Department of Health of Florida and obtain these medical licenses that they then go on to use as their profession and make millions of dollars every single year. Okay, so this doctor, he did not do his job properly. Injuries are present in these pictures. You'll hear he tries to argue with me, a patient who knows otherwise.
I'm Dr. Deukmedjian.
Hello.
I looked at your MRI, and I know it's a bit old, but I had a chance to take a peek at it. What's going on? Are you having neck pain?
Yeah, and a lot worse than that. Okay, my hand, it's on my left side, upper area of my neck, lower skull.
What's bothering you? What's hurting you?
Okay, I have for the last 4 years intense pain on the left side of my neck. I cannot turn my head left or right easily.
Take your collar off and put your finger exactly where it's hurting you so I can see it.
Okay. Yeah, give me a minute because there's a lot of pain here. Okay. Yeah, I can't really turn my head so easily.
Yeah, go ahead and show me exactly where it's hurting you with one finger.
Okay.
I need you to turn more. I gotta.
Okay.
Don't look at me. I need to. There we go. That's what I need to see.
Right here.
Left side?
Left side, yes, sir.
And just turning to the side hurts like heck.
Moving my head out of a very limited range of articulation is a lot of pain.
What about turning to the right side? No problem?
I cannot turn left, right, up, or down very easily. There's a lot of pain.
So much.
Yeah.
I think I know what's wrong.
Did you take a look at those images?
Oh, yeah. I'm looking at them right now. Sorry, I'll share my screen with you. I apologize.
Yeah, I got the images here too that I can share possibly.
I don't need you to share with me.
Okay.
I have them right here. This is your MRI right here.
Okay.
All right. So the good news is you don't have any herniated disc on this MRI that I can see. Now your pain is coming up from C1, C2.
Yeah, it's around. I think it's around. Okay, could you go back? Yeah, you go. Anyway, you just passed that area where I believe there's a serious issue. Right here.
Okay.
Well, can you go? I wish that I could.
Here?
Okay, right there, and then it's below my brain. Can you see that?
Right here.
Yeah, that area to the left of your mouse cursor. Okay, now you moved out of the range. Okay, yeah, right there, and then to the left and up of your mouse cursor. That area right there, and you can see that the injury, it also kind of covers.
What injury are you talking about?
Okay, I'm talking about this broken piece of bone that came off the underside of my skull.
No, I don't think you have a broken piece of bone going on.
Is it possible for me to share these images, because I can show you otherwise? In 2018, I believe I broke the underside of my skull, and you can see this in these pictures.
But listen, you wouldn't see that on an MRI.
Yeah, you can. You can see also the side effects, because I broke the underside of my skull and I went into this emergency department. I was misdiagnosed, and then after several months passed, the area became infected. Do you have that other MRI? The MRI?
Listen, it doesn't matter because I don't treat this kind of stuff.
Okay, well, it's in the area of my spine, sir. You're a doctor, right?
I'm a doctor.
Okay. I wish that I got the pictures printed out here.
It doesn't matter. There's nothing I can do to help you in this area.
Okay, but yeah, it's going to be in the area.
Yeah, again, I'm not an expert, and I don't deal with this area, so I'm not going to address it with you.
First, second vertebrae. You deal with that issue, don't you? You can see an injury in the area. Can you bring up the overhead imagery, please? Of the go to the brain or the yeah. Okay, this one. Yeah, and I gotta get to
the top right there.
Okay. Can you bring, there's some other pictures in here.
That's what I have.
Okay. You got to bring up the,
But if this is below your brain, I'm not dealing with that. I already told you that.
okay, well, yeah, it's actually in the area. I think I broke the underside of my skull. There may be damage in that area.
Deal with that part. You're going to have to go see a neurosurgeon that does.
But okay, you can look at these pictures. Can you tell me if there's an injury or not?
I cannot. No.
You cannot?
I'm not. I don't deal with that area.
Okay, well, you
What
can.
does the report say?
What does the report say? Well, you're the doctor. I wanted to ask you, sir.
Yeah, this is an MRI consultation for the spine.
Okay, can you go to that area?
Just do brain stuff.
First, second vertebrae in the cervical column of my neck. And I've got an injury there that you can see.
It doesn't say anything here about first and second.
Okay, can you bring up...
The MRI of the cervical spine is essentially unremarkable.
Okay, you're going to have to look at the pictures. I was misdiagnosed.
Yeah, I'm not going to help you with that. That's not what I do. I
here.
deal with spine issues.
If you go up to this area where you were on the profile, you can...
We're done.
We're done. We're not done. Well, I'm not done because I got a real serious injury I need to have looked at. Right here. There's my brain. There's the cervical column. T1, T2. I got a broken piece of bone under my skull.